Good day, everyone. We are here once again on another episode of Health and Homes, and we are here today with you to talk on a very important topic. This topic makes a whole lot of sense to me. It rings bell. It rings bell because I have a direct contact with somebody that has a problem with this topic, and this topic simply is high blood pressure. High blood pressure simply means the high movement of blood through the arteries. And one major part of the body that does this movement of blood is the heart. The heart is a machine that pumps blood all through the body. What it does first is to pump and elects oxygen blood to the lungs. And the lungs oxygenate it and then pass it back for pumping to all parts of the body, through the muscles, through the cells of the body. We have different causes of high blood pressure, and I'm going to quickly run on that. We have the essential cause and the secondary cause. The essential cause of high BP is the high BP that is not traceable to any cause at all, while the secondary cause of high BP is that which is traceable to an health problem. So what are the risk factors? One of it is age. Immediately anyone starts aging, you face the risk of having high blood pressure. As you age, your blood arteries becomes less flexible. It doesn't have the flexibility like when you were young. The second important one is people with overweight. A lot of people that is obese or have a large weight needs to check themselves because they face a high risk of having high blood pressure. Another important one I would like to point out is people that takes alcohol. Let me quickly address this. One of the points of the risk factors is the sex. What I mean by sex is either female or male. And research made us to understand that men has the higher risk of having high blood pressure. Now, why do we men have to combine it again? By being a man, you are having a risk, facing a risk of having high blood pressure, and adding again alcohol taken to it, that makes it 2 in 1. Another important aspect of it is lack of physical activity. If you don't do one activity or the other on daily basis or weekly basis as the time permits, you face the risk of having high blood pressure. For anyone that has a history of high blood pressure running in the family has a tendency of facing the risk of having high blood pressure. We can also talk of ethnical history. Those people who are African Americans have the tendency of having high blood pressure, and so on like that. But the very important ones, which is very, very common with our own environment, is the age, alcohol, overweight, and lack of activity. Another most important one is our diet. Are we really eating right? If we don't, we have faced the risk of having high blood pressure. Right now, let us now move straight to what are the symptoms. A lot of times, people don't usually, especially those with high BP, they don't usually experience any symptoms. That is why high blood pressure is called a silent killer. For you to have high blood pressure right now, you can't easily say, this is what is happening to me, or until it is very high. We are made to understand that anyone that has 180 over 120 millimeter have the following symptoms. One of it is dizziness. Whenever you wake up on your bed in the morning and realize you are feeling dizzy, please and please just call your doctor immediately, because it's one of the symptoms of a very high blood pressure. Another one is blurry eyes. When you start having a blurry eyes all the time, please go to the hospital and have a check on yourself. When you also have traces of constant headache, have a check on yourself. Anybody that just suddenly started having nose bleeding, you need to have a quick check on yourself, because it's part of the symptoms that is traceable to high blood pressure. Then breathlessness. You breathe restlessly, you are always panting without running. These are symptoms, and there is need for you to quickly have a check on it. So let us look at the complications. It breaks the blood vessels of every individual that has a very high blood pressure. immediately your body cannot hold it, the blood vessel breaks away. And the consequence is this: it leads to cardiovascular disease. And this is one of the major diseases that is so common in the economy today, in our environment today. A lot of people having stroke, heart attack, and these are ailments that people don't really get out of the problem as soon as they could, because the best is to prevent and never to look for solution. Because this is not an ailment you can actually walk into the hospital and say, look, I have stroke, get it off me immediately, just like someone that has malaria. No, it is a complicated ailment. And because of this, we all need to address it with a very, very important attention. We need to be conscious of it. If you have a traces of high blood pressure, I'll advise you to always have a check on your BP. These are the solutions. Check your BP on regular basis. Get a machine in your house that you will use in checking yourself on daily basis. And for those that can have the equipment right in their house, you can go to the nearby hospital, have a check on yourself twice in a week. You have to do this. The second one is for those that are overweight. You need to go down. You need to go down. If you are obese, you need to have a check on your weight, so that the risk of having high blood pressure will not be traceable to you. If you have high blood pressure, avoid taking alcohol. It's dangerous to your health. You need to have relaxation time. Relax all the time. We have a whole lot of things to achieve here on earth. Yes, but you need to find a relaxation time for yourself. If we should look at the commitments, a whole lot of job we have on our table, most of us won't even have the night to rest with. Yes, because the more money we make, really, the more committed we become to our activities. But if it's detrimental to our health, it's dangerous. You need to relax. You need to take your medications. We have a lot of measures you can use to put things right when you have high blood pressure. We have the organic measure, which is the very important and effective measure you could take to ensure you have your blood pressure in check. Go organic with your medications. Some medications leaves you with side effects. Don't go for them. Go organic for your medications. We have to ring this, because the side effect of you taking your medications on daily basis is also very, very dangerous. And that is why I have to ring this. Then you need to sleep very well. Good sleep helps to, is a solution. It helps to keep you at a normal measurement rate of your BP. So all these points, all together, and having regular physical exercise is very important. When you ensure that blood flows through your arteries on regular basis, not once in a while thing, because most of us are always busy with our home activities. We are always busy with the office activity, and some will even tell you, look, I've done exercise for the day. If you look at what I went through today, you won't ask me to go and exercise. That is very different from what we are talking about. Your activities at work or at home has nothing to do with the physical exercise you are expected to do. Our society is contributing to a lot of ailments that is coming up nowadays. So there is need for everyone to have a check to know if you have it. And for those that have checked and realize they have it, you need to follow all these steps we have mentioned, so that you will be able to live a long and healthy life. A life that is lived healthily with happiness and joy is a profitable life. Health and Homes TV cares for you, and that is why we have brought this important information to you, so that you will be able to take good care of yourself. No matter how healthy one might be, you need to live a healthy and peaceful life. If you need to talk with us, you can message us on our email, healthandhomes@gmail.com, or call the number on the screen and someone will be ready to attend to you. Thank you for listening today. God bless you.